Once again, it is Howard Bachner, editor-in-chief of JAMA. Jay Bhattacharya. Jay's a senior fellow at the Freeman Spogli Institute for International Studies, and he's a professor of medicine at Stanford.
Thanks, Howard. So I think let me just start very quickly with the premises of the declaration. The first premise is that there's not possible to get zero COVID. That is an impossible goal, and we should give that up. At this point, the disease is so widespread that zero COVID would be utterly disastrous to even attempt to achieve, and it's not technically possible. A second premise is that I think everyone will agree that this is an absolutely deadly disease for people who are older and for people who have certain chronic conditions. Right. The infection survival rate from seroprevalence data, now 50 some high quality seroprevalence studies says that there's a 95% survival rate for people who are 70 and older. For people under 70, it's 99.95% survival. It's much less deadly for people who are under 70, 99.95. And for children, it's frankly, the flu is worse. We've had more flu deaths among children this year than COVID deaths, just in terms of mortality. Third premise is that lockdowns have absolutely catastrophic effects on physical and mental health of populations, both domestically and internationally. I'll talk about that, I think, going forward. But that really sort of plays a big role in the thinking about the Great Barrington Declaration. So that for people who are under 70, under say 60 or 50, the lockdown harms are, again, mentally and physically, are worse than COVID. That lockdowns have also they're not like universal lockdowns. We've asked essentially poor people, minorities, urban workers, even vulnerable ones, older ones, a 63-year-old bus driver, a Costco clerk, 60-year-old Costco clerk with diabetes, to go work and expose themselves. Lockdowns themselves, in fact, create vulnerable people and put them in places where they are going to be at risk. I mean, the key thing is context, because you're right. This is a deadly pandemic, and there's no good outcome from it. There's only minimizing harm and death by choosing policies wisely. Let me document some of the harms of the lockdowns that Mark as I've advocated for all the way through the epidemic. Among young children, the child abuse is skyrocketed. Often it's picked up in schools. Our schools have been closed, and so it doesn't get picked up there. There's domestic abuse that's happened. The CDC estimated in June that 1 in 4 young adults seriously considered suicide. 1 in 4. Normally it's something that's on the order of 4%, is now 1 in 4. The school closures have led to vast harm in terms of inequality. Right, so there's going to be kids. This is probably the single biggest generator of inequality since segregation. This the lockdowns of the schools and society more generally. Physical health, cancer screening was an 80% drop. I think you all just published a report about that in colonoscopy and mammograms. There's going to be more stage 4 breast cancers and colon cancers than we've seen in a very long time. Cancer, we actually made a lot of progress against in past few years. That's about to be reversed, if it not already is. Cardiac procedures, a drop in angioplasty, a very, very sharp drop. People stayed home. They're more afraid of COVID than getting treated for heart attacks. That's happened already with the lockdowns. These are not more internationally. The UN estimated in April that 130 million people are on the brink of starvation or potentially at risk of starvation because of the economic dislocation and harm caused by the lockdowns. Mark said that, look, the viral transmission destroys the economy. I hear that, and I hear something like in the Vietnam War, we have to destroy the village to save it. That's not right. The economy responds to the policies we pick. If we tell all our businesses to close, our schools to close, the economy will be harmed. The economy rebounded when we lifted up some of those restrictions in the third quarter, right? Now, we talk about the economy as if it were just dollars, but it's not. I've documented, I think already, all of the devastating physical and mental harms that are caused by lockdowns, both nationally and internationally. Hundreds of millions of people thrown into poverty worldwide. If you're sitting at $2 a day of income and you have a GDP hit, you know, 20%, I mean 10%, or whatever the number turns out to be, you're going to starve because you know it's a disproportionate hit. It's incredibly unequal, unfair, immoral policy that we've adopted, and to say that we can't protect our vulnerable, I think that's just a failure of imagination. Logistically, it's not impossible. It's difficult, but we have to put our minds to it. I think reducing community transmission has become a crutch that's prevented us from putting our minds to it in appropriate ways. I mean, I don't think the lockdowns have a very good record here at actually reducing the spread. What the lockdowns do is they delay if they do anything, is they delay when the cases occur. They don't actually eradicate the disease, don't eliminate the disease. And while they're in, they cause absolutely catastrophic harms to people who have relatively low risk from the disease. And I think it's a mischaracterization to say we say let it rip. I don't want to create infections intentionally, but I want us to allow people to go back to their lives as best they can when they with the understanding of the risk that they're taking when they do it. Right, 99.95% survival. Right. So I think that's the basic idea. The harms of the lockdowns are worse for most people. For many people. So I think when you say do no harm, it's following that principle in the context of these non-vulnerable people. People who are not vulnerable to the COVID, but much more vulnerable to lockdowns. The question is, how do you minimize that harm, that death and human misery in the meantime? That's the only question, right? It's not a question of like, we shouldn't in public health be looking at only one thing. We should be looking at everything. We should think about health much more holistically. We're not just here for infection control. We're here for maximizing human well-being, right? That's what public health and medicine is about. And I think that this singular focus on one disease has created this blind spot, I think, for the harm that we're going to cause, that we are causing with these policies. So the idea of waiting for a vaccine, the vaccine's coming no matter what. I really hope very, very soon. In the meantime, we shouldn't be causing extra harm. That's why the lockdown. That's why we're arguing against the lockdowns. How do you Mark mentions the socioeconomic status issues with in suffering from COVID. I completely agree with that, but I think the lockdowns are in part responsible for that. We've asked poor workers, deemed them essential, and asked them to go out and get exposed. We have not adopted policies that protect them, in part because we haven't thought of them as vulnerable. Focus protection basically says, let's figure out who folks actually are vulnerable. And like I said, I think we now scientifically have a very good idea, and adopt our policies around that. I mean, I mentioned one, using disability laws, accommodation laws to protect folks like that. There's lots of other possibilities, I think. We spent trillions on the CARES Act. Why did we not spend money on that, right? I mean, I think these kinds of ideas are not pie in the sky. They're not fringe. They're absolutely central to how we normally deal with regular public policy issues. And instead of that, we've taken this absolutely extraordinary step to say, well, let's just lock down society. And by doing that, that'll protect everybody. But it hasn't. I think that's the key thing. I think that I want to get across to folks in the audience. This is not a question of well, let's let it rip through society and be irresponsible. The issue is, let's be responsible much more comprehensively than we have. COVID is not the only public health danger we face in society. And by locking down, we end up with a much worse outcome for many more people, not just in the United States, both in COVID and non-COVID, but also around the world. I've argued for clear public health messaging. If the public health messaging is wear masks, social distance when you can voluntarily, I'm completely in favor of that. I think people will naturally do that when infection risk is high. I'm not against that. The issue is the lockdowns, these mandatory measures that close schools, close churches, close art, close all of culture, close all of society, close businesses, and end up harming people psychologically and mentally and physically. That's what I'm against. That's what the Great Barrington Declaration calls for. Those voluntary measures, fine, absolutely.
But that's contrary to the process of building up herd immunity through natural infection. You can't have it both ways.
It's not contrary at all, Mark. The spread of the disease will happen naturally but because because people are doing the natural things they normally would do to prevent harm from other sources, right? So the issue is not counting cases. The issue is preventing harm to people who face more harm and damage from the lockdown, mentally, physically, than they do from COVID. Basically, the lockdowns say, look, you take this harm, you 63-year-old bus driver, you go take this harm. You a 10-year-old kid, you can't go to school. You can't go pray. You can't open your business. You have to go out of business. But that's what it says. That's what the lockdown policies that actually have been adopted in the United States have been. It's not to work. I would call lockdown what we're currently doing. Businesses are closed, schools are closed, churches are closed, art's closed. Almost every normal aspect of society is restricted in some way. It's not as strict as a quarantine, but it is a lockdown. And to pretend like these are minimal interventions I think everyone listening understands that can't be true. These are absolutely extraordinary interventions, and they need to have extraordinary evidence behind them. They've failed to date to control the epidemic, and they will continue to cause absolutely enormous harm if we keep doing them. If we keep this policy of lockdown, we will have the same kind of outcomes we've already had: high excess deaths and sort of indifferent control of COVID. If we adopt a focused protection idea, I think we'll have much better outcomes. It's still a tragic thing. We're still going to have misery and death going forward until we reach a point where there's sufficient immunity, either through a vaccine or through natural infection. The only question is, how do we minimize the total harm in the meantime?